I am the head of the Drug and Substance Abuse Control Division at the Ministry of Health, State Department of Public Health and Professional Standards. And I'm greatly delighted to be here in this conference where we are discussing taxation of tobacco products. As you're all aware, we are now having novel nicotine products. We had a task force earlier in the year which was able to demonstrate that we have a lot of this a proliferation of these products, and therefore together with other stakeholders, the Tobacco Control Board and our friends in the region, we are here to discuss taxation because as a ministry, as a state department, we are committed and we would want to reiterate that we would like taxes to be escalated, the excise taxes as a deterrence measure, and that also the resources which accrue from those taxes can be used for the so many activities which you are asking for. In the coming year, we have planned to do a lot of public awareness campaigns. We have targeted to go to all 47 counties, conducting mass public education campaigns on the harmful effects of these drugs. And here we are talking about tobacco, we are talking about alcohol, we are talking about the narcotics, we are talking about the psychoactive drugs like mogoka and all that. We are also going to be discussing with the public about how some of these drugs and products can cause cancer and how we can be able to prevent the same. We'll also be telling the public on how they should go for early screening and so on and so forth. We'll also be capacity building our healthcare workers in the 47 counties so that they are also equal to the task when they are treating patients and when they are conducting campaigns. At the same time, we'll be conducting research because we have discovered that without data, our plans and policies and strategies are not well aligned. So again, in the next 1 year, we'll be having about 5 studies which will be commissioned to investigate the different aspects of drug and substance abuse. And I'm sure we'll continue sharing with you.
Doctor, Chair said that there's a gap that need to be addressed by the policymakers, even by the government.
Yes.
What are those gaps that need to be addressed so that we can be able to make Kenya safe?
Thank you so much. So in the task force, which I was privileged to chair, we were able to identify about 5 main issues, but I'll discuss 3 here. The first one is we discovered the Tobacco Control Act, which was enacted in 2007, has been overtaken by events. The new products are innovative, and they were not contemplated in 2007. And therefore, we must amend the Tobacco Control Act so that we can align it to the new products in the market. And as we amend that Tobacco Control Act, we have also put in the element of taxation so that we can scale up and include these novel products within the tax bracket. Because as we sit here today, they have not yet been encompassed there. We were also able to note that the graphic health warnings, which had been in the market, had been overtaken by events. And again, together with the Tobacco Control Board and other stakeholders, we were able to develop a new set of 17 graphic health warnings. And God willing, in the very near future, they should be gazetted, and they'll go a long way in educating the public and causing deterrence so that we are able to reduce. We were also able to discover that the public awareness of these drugs was quite low. So, and that's why I've just mentioned that one of the tasks our ministry, together with the board and other stakeholders, is to conduct mass public awareness so that we can bridge that gap, ensure that everyone knows, especially our youth who have been targeted by the tobacco industry.
Okay, what's the statistics of the people who are using tobacco and how many people are affected by the cancer?
Well, I might not be able to give you the exact statistics on the cancer, but I can tell you a study which was just released 2 days ago has shown that our children between 10 and 17, we have about 600,000 consumers of nicotine and tobacco products. That tells you about 2.5% of our youth are already consuming, and the tobacco industry is targeting that age group, so that's where they are recruiting them. And therefore, as a ministry, we have targeted a lot of energy, a lot of strategies to ensure that we educate that cohort. In average, the tobacco consumers in the country amongst the adults is about 11%. And again, we want to reduce that significantly so that we can bring it down to measure up with the standards which are required.
Okay. Kindly. Mushangi, kindly.
Sorry?
are saying there's a lot of input from the industry. Is there any regulations?
Well, the tobacco industry are traders. Those are traders. Their motivation is to make money. Our motivation in the ministry is to safeguard public health, to ensure that no Kenyan dies or gets any disease out of these products. So the tobacco industry, our job is to control and regulate them, to ensure that we license them, to ensure that we register them, to ensure that we go into the market and know which products they are selling, so that they are not selling products which have not yet been licensed by us. Of course, we are working very hard to ensure that we are up to the task, and that's why we have united here as stakeholders.